Hello, and welcome to the video. In today's video, we are going to briefly talk about cardiac arrest. This condition is often confused with heart attacks. Although both conditions deal with the heart, each of these conditions have distinct characteristics. Approximately 356,000 out-of-hospital cardiac arrests occur annually in the United States, according to the American Heart Association. Additionally, there are about 209,000 in-hospital cardiac arrests each year. These numbers highlight the significant impact of cardiac arrest on public health in the U.S. In the United States, certain populations are at a higher risk for cardiac arrest. Older adults are more likely to suffer from cardiac arrest. The risk increases significantly with age, particularly for those over 60. Men are at a higher risk than women. Studies indicate that men are about twice as likely to experience sudden cardiac arrest compared to women. African Americans have a higher incidence of cardiac arrest compared to Caucasians and other racial groups. African American men and women are more likely to suffer from cardiac arrest, partly due to higher prevalence of risk factors such as hypertension, diabetes, and heart disease. Now, on to the video. Cardiac arrest is a sudden and unexpected loss of heart function, breathing, and consciousness. It usually results from an electrical disturbance in the heart that disrupts its pumping action, stopping blood flow to the rest of the body. This is different from a heart attack, where blood flow to a part of the heart is blocked. Cardiac arrest is a medical emergency and, if not treated immediately, can lead to death. The immediate treatment for cardiac arrest includes cardiopulmonary resuscitation, CPR, and defibrillation to restore a normal heart rhythm. The signs and symptoms of cardiac arrest are often immediate and drastic, including sudden collapse. The person may suddenly collapse without warning. No pulse. The individual will not have a detectable pulse. No breathing. There is an absence of normal breathing. The person may not breathe at all or may have gasping breaths, agonal respirations. Loss of consciousness. The person will lose consciousness quickly. Unresponsiveness. The individual will not respond to attempts to communicate or stimuli. These symptoms occur abruptly and require immediate medical attention. If someone is experiencing these symptoms, it's crucial to call emergency services immediately and begin cardiopulmonary resuscitation, CPR, if you are trained to do so. Using an automated external defibrillator, AED, as soon as possible can also improve the chances of survival. An automated external defibrillator, AED, is a portable, life-saving device designed to treat people experiencing sudden cardiac arrest. It delivers an electric shock or defibrillation to help the heart re-establish an effective rhythm. AEDs are designed to be used by laypeople with little or no training. They provide step-by-step voice instructions to guide users through the process. The device automatically analyzes the heart's rhythm and determines if a shock is necessary. It will only deliver a shock if it detects a life-threatening arrhythmia, such as ventricular fibrillation or pulseless ventricular tachycardia. Using an AED within the first few minutes of cardiac arrest can significantly increase the chances of survival. For every minute that passes without defibrillation, the chances of survival decrease by about 10%. Now, let's talk about prevention. Prevention is always better than treatment. Preventing cardiac arrest involves addressing the underlying risk factors and maintaining a heart-healthy lifestyle. Here are some key strategies. Healthy diet. Eat a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit saturated fats, trans fats, cholesterol, salt, and added sugars. Regular exercise. Engage in regular physical activity, such as 150 minutes of moderate aerobic exercise or 75 minutes of vigorous exercise per week, along with muscle-strengthening activities. Avoid smoking. If you smoke, seek help to quit. Avoid exposure to secondhand smoke as well. Manage blood pressure. Keep your blood pressure under control through diet, exercise, medication, if prescribed, and regular monitoring. Control cholesterol levels. Monitor and manage your cholesterol levels. High levels of LDL cholesterol can lead to heart disease. Monitor and manage diabetes. Keep blood sugar levels under control if you have diabetes, as it significantly increases the risk of heart disease. Limit alcohol intake. Drink alcohol in moderation. Excessive alcohol consumption can lead to high blood pressure and heart disease. Manage stress. Practice stress-reducing techniques such as mindfulness, yoga, meditation, or other relaxation methods. And medications. Take prescribed medications for conditions like high blood pressure, high cholesterol, or heart disease as directed by your healthcare provider. Okay, now let's do a quick recap of some important things to remember about cardiac arrest. Cardiac arrest is a sudden and unexpected loss of heart function, breathing, and consciousness caused by an electrical disturbance in the heart. It differs from a heart attack, where blood flow to a part of the heart is blocked, but the heart may still be pumping blood. Here are some signs and symptoms. Sudden collapse, immediate loss of consciousness, no pulse, absence of detectable heartbeat, no breathing, lack of normal breathing or gasping breaths, and unresponsiveness. Person does not respond to any stimuli. If you see someone who exhibits signs of cardiac arrest, you must act quickly. Call emergency services immediately. Begin CPR to maintain blood flow to the brain and other vital organs. Use AED, automated external defibrillator, automated analysis. AED analyzes the heart's rhythm and delivers a shock if needed. Step-by-step instructions. AEDs provide voice prompts for user guidance. Cardiac arrest is a critical medical emergency requiring immediate intervention. Prevention focuses on maintaining heart health through lifestyle changes and regular medical care. Treatment involves rapid response with CPR and AED use to improve survival chances. Understanding these key points can help in recognizing, preventing, and responding to cardiac arrest effectively. That will conclude our video on cardiac arrest. Thanks for tuning in. Hit the like, share, and subscribe button. Feel free to share your thoughts and comments below. Please continue to support our channel. We greatly appreciate it. See you all soon. Until then, bye for now.